Hi, everyone. My name is Danielle Charles. I am a first year student at UCSF Midwifery Program, originally from New York. My pronouns is she and her. What brought me to midwifery? I've been a labor and delivery nurse going on about 5 years, a bedside nurse for 8 years. Always loved women's health, in specific, the laboring process and supporting families in the labor room. But I saw a lot of discrimination, especially for BIPOC patients. And so I wanted to advocate and be able to support and provide better care for our community. So that's what's brought me here.
Great. Thank you, Danielle. Yahaira?
Hello, my name is Yahaira Paredes. I am at Cal State Fullerton, and my pronouns are she and her. I'm originally from the Los Angeles area. I went into midwifery originally. That's the reason why I went into nursing. I wanted to, I loved everything about pregnancy, birth, and I wanted to learn more and more. So I went into nursing with that, path in mind, and I kind of took different routes. I ended up getting into management kind of early on in my career, picking up a lot of things from a lot of different mentors along the way. And then I went into education, and then I went in to get a master's degree as a clinical nurse specialist. I went to Cal State Dominguez Hills, and then I worked at a few hospitals doing perinatal CNS work. And again, I learned a lot of things. And then I never left that thought that I originally, wanted to go in and work as a midwife. And then I fell into a hospital that had midwives on staff. And then it excited me again. So I kind of chatted with a couple of people. By this time, I had 3 children, working full time, kind of doing lots of things. And I thought, well, let me try, let me see if I can do this. So it happened that COVID hit at that time, and I decided to take a step back from my CNS work and go back to the bedside and just get back in. And then at that time was when I don't know how I decided that was the opportune time, but it just felt right at the time. So I thought, well, let me look into this. And it just so happened that deadline was like a couple weeks away. I had some time to put everything together, and my husband was supportive and said, yeah, let's do it. Let's go for it. So I did it, and here I am. I'm almost done with the program. I'm a second year, so I'll be graduating later this month, actually. So I kind of took a little, scenic tour around, but I feel like a lot of those things have really helped me now in going into midwifery.
Thank you, Yahaira. I'm so glad to have both of you here sharing a bit of your stories. For a bit of context for folks joining us, we have several folks that are participating in the Midwifery Mentoring and Belonging Program also on this call. We have mentors, we have mentees, other current students, and for those participants of MMB, feel free to throw introductions into the chat as well. Cal State Fullerton and UCSF Nurse Midwifery.
Recording in progress.
Whoops. Okay, I think there's an echo in the lobby. Thank you. So I wasn't sure if that was on my end. So for the BIPOC aspiring midwives that are joining us, just wanted to share that Cal State Fullerton and UCSF nurse midwifery education programs have come together for a mentoring program for all of the BIPOC identified students. And so we bring together every quarter two current students to reach out and share with you some of their experiences. And we're using past questions that other BIPOC aspiring midwifery sessions have brought to us. But as I mentioned before, we're going to open this up in the last 15, 20 minutes for this particular group to bring questions that respond to what you're looking for and what you're interested to hear. So without further ado, I'm going to bring the first question to Danielle. Danielle, what advice do you have about preparing strong application? And what do you think makes a strong candidate?
For preparing to become a strong have a strong application, I think the first thing is getting experience in any way that you can do that, becoming a doula, becoming a nursing assistant, volunteering, shadowing, networking. I think it's difficult, but it does require a lot of dedication to do that. But I think reaching out to different midwives or nurses that you see, in the birth care circle, reaching out to them, trying to get into connection with people, just to trying to get like understanding the experience of the field and kind of exposure. I think exposure is really important. It kind of lets you know what to expect. Um, can you do this? And is this right for you? Before kind of, jumping into it, because I think it requires a lot of dedication, our work. That's one way. I would say organizations as well. Getting involved in organizations, state-wise, local as well, and just kind of branching out and getting out there and networking with people. I think that what would make a person a strong applicant is just hard work, dedication, and having all those things like exposure, and having understanding. I think that my experience in labor delivery before even starting the program, I think that a lot of people thought that labor delivery was the cushion specialty, and it's like the happy place, and it's where everyone would want to be, and that part of the birth world. But it comes with a lot, and I think in order to understand that, you have to get exposure and seeing kind of what it comes with and the type of person that is right for this specialty in this field. So.
Great. Thank you, Danielle. And to just add, every midwifery program has variable requirements in terms of experience. And what Danielle said about exposure is really important. And some places have a nursing practice prerequisite and other places don't. So something to pay attention to as you look at which programs are right for you. Yahida, what things do you wish you knew before starting midwifery school?
That's a good question. So I think when you think about heading into a midwifery program, you probably can imagine it's going to require a lot of work. I think for me, one thing, I mean, I knew it wasn't going to be easy, but I think I didn't realize how much actual time would be required to go through your courses, commute, complete your clinical time, study, plan ahead, organize. So I think that's one big thing for me. It was the time commitment. Once I got into the program, it was, it kind of started slowly and then it built up. By the time, I'm in the last year, I feel like at that point, you had to kind of look at, can you continue working full time? Do you have to consider a part-time option or per diem? So for me personally, I went from full time and then so slowly started to decrease my work commitment because school required so much. And that wasn't something that I had been planning to do or really thought about until I was in the program. So, I mean, I wish I would have known that ahead of time. Maybe I could have prepared a little bit better in that sense, but I think I have a really nice, my work site is incredibly accommodating and willing to work with me, and working nights for me, at least, it's hard, but you're able to kind of coordinate some of that. So I think that was a big thing for me. Another thing was money. So, obviously it costs a lot of money and there are different ways to access resources. So for me, one big thing was Cal State Fullerton has a grant opportunity and I didn't know about it until I was in my second year. So I missed out on that grant that first year. And I wish I would have known or paid more attention perhaps to emails or things, but it wasn't until somebody actually came into our class and spoke to us about the grant. And so I always think now, like, look at your emails. If there's, talk about resources or grants available, look to see if that might be something that you're eligible for, because that made a huge difference. And I wish I would have known that earlier. And then I think the third thing is just resources. So for me, I am kind of old school. I really enjoy books and different ways to learn. And so for me, there's a couple things, and I actually have them here just to show you. So there's a couple books that I feel like if I would have gotten in early on, maybe I could have just started working with them early. So this is one that kind of was recommended to me once I hit the clinical site by, I think it was by another midwife. So this is it's a handbook. It's an obstetrics and gynecology. A lot of people have it. It's nice. It's easy. You can just start making notes in it. This was a good one. Another one is this one. This is another handbook. It just has a little bit different information than this other one. So it has like a lot of the complementary alternatives or medicines you want to talk about. And then recently, I just found this one through a midwife, and it's a handbook on contraception. And it's really nice. It's small, but it has everything that you need. So I wish I would have had those earlier. Now I'm just taking advantage of them, but those were helpful. And then like some podcasts that kind of I've heard about through school and picked up on different things. So I've got a couple of podcasts that I listen to more often, especially when I'm driving or commuting. So I wish I would have had those earlier on.
Thank you, Yahida. And Yahida, if you have those ready, those podcasts, if you would enter them in the chat, that would be great so other people could check them out. Thank you. Danielle, I'm going to switch things up a little bit because, Yahida was sharing a bit about financial resources, and this was something that you and I had talked about. So I'm wondering, before we talk about a day in the life, could you share tips on raising money for school prior to applying, during, and throughout school?
Yeah, for me, my experience was, I guess, a little bit different because I was a bedside nurse prior, and I knew I was going to go back to school. So I kind of started. I guess my real awakening came after I graduated nursing school, and then I got, this 3 to 6 months later, I got these loans, and they were like, "Hey, you have to pay this," and I kind of was like, "Whoa, okay, how am I going to do this?" And I kind of learned during that period about budgeting and how to pay things. So that was my first kind of experience of actually calling the loan companies and really getting a payment plan that fit for me and really digging deep. And I also was reading some financial books. And I know that financial literacy sometimes scares a lot of people, but I was like, in order for this to get away from my fear from this, I really need to dig into this and understand what this is so that I can better be able to manage my money and, afford and prepare for graduate school. So I was reading books. And then prior to, I think after about 6 months into the pandemic, I decided to do travel nursing. And with that, I had the ability to save a lot of money to prepare for graduate school, but I also knew that it was going to cost way more than I would be able to prepare for just because of the budget. So what I did was a couple months, once I got accepted, I think I spent about 6 months prior, and I created a Google Doc, and I did a lot of research for scholarships. So I would separate the Google Doc by months of due dates in different organizations, and I would write it down. Okay, so this is I would say January, there were 3 scholarships that were due in January. So I kept track of it, and I would put it on my Google Calendar to remind me. And I think before I even started the program, I probably applied to maybe about 10 to 15. And in total, after, I guess, being, midway in the first year, I have probably applied to about 30 scholarships. I have gotten lucky after a couple months of being in the program and receiving a couple of them, but it required a lot of dedication and a lot of organization on doing this. But there is money out there for midwifery, y'all. It's there. It just requires dedication and a lot of organization. And so I was creating different essays, and I would have them organized, and then I had a sheet for references. And then I had a sheet also for recommendations. So what I would do was I wrote kind of a sheet about myself and attached it to my resume. And I kind of sent it to all my managers, my mentors, or anybody that I felt could speak on my behalf for the scholarships. and speak well, and speak about my different clinical experience and my interests and the conversations that I think that I had with them, that they can write a good recommendation for me. And so I think that might have been the first month that I started the program that I sent it out. And then I had about 6 recommendations. And so anytime, because sometimes you'll realize last minute, like, okay, this scholarship is due in 3 days. And it's kind of hard. And we miss a lot of opportunity on scholarships because you don't have that scholarship packet ready. So I kind of got that packet ready before, and I was like, okay, now I know I have this and I can easily submit for all these different scholarships. So I think that is important. And then I also met with the financial department about 2 or 3 times. And I would, ask them a lot of questions and ask them about a lot of different resources, a lot of different funding out there. And, just letting people know also in the community, I'm looking for scholarships, I'm looking for funding, I'm trying to fund this. And I also know one or the 2 things that some people did. They did like Amazon lists, and they would send it to family members, kind of saying, I need this, I need these books or these supplies, and people will kind of contribute that way. I did have my mom and my uncle kind of help me with like school supplies, and like kind of just like sent that portion, but also GoFundMe is also another option. And you'll be surprised on who's out there wanting to support you on this journey. So don't be afraid to ask for help.
Thank you, Danielle. I know you've put in a lot of time and energy into thinking of how to fund midwifery education, and I know from the research and from students, this is a really important thing to address, and glad we were able to hear from both of you about your thoughts on it. So, Yahida, I'm going to move to you next. And wondering if you could describe a day in the life of a midwifery student from where you are and where you sit at your program.
Okay, so might be a little bit different than Danielle because we're in different years. So I'm nearing the end of my rotation. So typically at this point, we have one day on campus Thursdays. So from 8 a.m. till about 6 p.m., we're in various classes. So we have that time to go through all our courses and review kind of our experiences and things. And then the rest of the days, I'm either scheduled to work at the clinic, or I'm scheduled to work at my hospital that I'm assigned to for midwifery rotation. So typically I try to get in one clinic shift and one intrapartum shift in the week, so that I, can plan it all and get it all done on time. So for example, a clinic shift, so one thing that you should know is that I got placed at a facility that's 90 miles away from my house. So it takes kind of a lot of planning to make sure that I'm getting there on time and have my food and everything ready to go. So I leave fairly early and I get there a little bit early. I usually have, what has helped me is like note cards, like index cards. So I carry those in my pocket. I carry my little resource guide, my little red one, my stethoscope, those kind of things. And if I'm heading into the hospital, then I meet with my preceptor typically a little before 7, and then we get a handoff from the other midwife, look at all the patients that we have, in labor. We look at patients that are in triage, either waiting to be seen or have been seen. And then we look at how many postpartum rounds we have to do. And so then after we've gotten a report from our midwife, then we go to like safety rounds with the medical students and residents that are also training at the particular facility that I'm at. And then we go through every single patient. The midwives go through who's in labor, who's in triage. We don't go through our postpartum, but we go through. So then the physician team also has an idea of what kind of situations we have on the board, or questions we might have. We can ask them at that point, and then we look to see then, who's the highest acuity, who do we go see. Then we make rounds, so if it's a labor patient, we go check in on the labor patient, look at the plan of care that's already established, and then see what we can do next and when are we going to reassess them. So then that's kind of how we navigate. look at the labor board, look to see if there's anybody in triage we need to rotate. And then I try to get to the postpartum rounding fairly early in the morning, because a lot of them, want to go home and make sure that they've got what they need before they go home. So then like where I'm at, once you've been there quite a bit, they start to allow you to do more and more on your own. For example, like with the site that I'm at, once you've been there for a while, you get to hold the midwife phone versus the student phone. So you take all the phone calls and triage them and work with the staff, put a plan together, and then you tap into your midwife preceptor to make sure that your plan is appropriate, and if you have any questions and things like that. And so I kind of spend my time on the floor, talking to people, looking to see what's going on, so then in the clinic, same sort of scenario. We get there a little bit ahead of time. We get like a list of all the patients that are going to be seen today. You can kind of see, if they're there for like a pregnancy visit, is it birth control, is it, vaginal bleeding, or whatever it might be. So then I start looking again with my index cards. I start preparing for each patient, look through their chart and see some key questions I need to ask or follow up and things. And then I usually review the patient with my preceptor before I go in to see them. So at this point, I'm seeing the patient on my own. I'll go in and talk with the patient, go through my questions, assessment, and then I will come back to my midwife and make sure that we're on track. If it's a skill like putting in a next plan or something, they have to come with us. So we work together on that. Or if it's something else, then, I can do that on my own. And so we kind of review the plan, go back to the patient, make sure it's good to go. And then the patient is discharged. And then, I work on the chart and get ready for the next patient. So clinic is really fast paced, and, they see a lot of patients, and I don't see every single patient with them. We kind of have my patients, and the midwife keeps her patients, but she still works with me to make sure that we're, working appropriately. So it's kind of the life. And then we have to log all our experiences, our hours, our evaluations at the end of the day to submit it to our school. So it's kind of a quick synopsis.
Thanks, Yahida. That's a lot. You're doing a lot. And I want to name too, Yahida, you are not that far away from graduation. So this is like end of the program, and you're carrying all these things: class, inpatient clinical, outpatient clinical. Great. Danielle, do you want to share a bit about what day in the life is like for you, and maybe remind us where you're situated in the program?
Yeah, so I'm in the first year, and I would say I'm midway in the first year. So this is my third quarter. So a day in my life as a student midwife, I think, goes with a lot of organization. I'm currently doing right now clinicals in antepartum. So I am in one of the clinics in San Francisco. So I usually do about 4 to 5 hours a week, but I also still spend we have 2-day requirement for classes. So I have classes Wednesday, Thursdays. I am in clinicals on Tuesdays, and Monday, the entire day for me is usually studying and preparing. I don't have the ability to pre-chart outside of clinicals, but I do go in early on Tuesdays and pre-chart there. So I'm kind of looking at my patients, what patients I'm seeing. I'm at the point where I'm currently seeing about 3 to 4 patients. It kind of increases with time. I started off with seeing 1 to 2 patients the first quarter by myself, and building to get there, and now seeing about 3 to 4. And I think the same experience, kind of just checking in with the midwife and making sure I'm not missing anything. And I think just building on all the academic stuff, like the didactic stuff we're learning in class, and adding it into the clinical experience. So currently we are learning intrapartum in class. And thank you, Nicole. We're learning intrapartum, and I'm super, super excited about this part. Antepartum for me was a little bit different because I mainly have experience in the hospital. So I think for me, I learned that okay, antepartum was a little bit of my area where I didn't have the most experience. So I spent a lot of time trying to kind of get the basics of that down because I knew okay, this was something that I didn't have experience. Intrapartum, I have a little bit more experience, but again, it is still building on my experience that I have as a nurse to midwives, kind of like expanding on that and like really looking at it a different scope. I think one of the things for me is really turning off my nursing hat, like having it, but turning it off and turning on my provider hat because I'm no longer a nurse anymore. I'm now moving into the making the decisions and being the person that orders things and prescribes things and refers things and actually makes a clinical decision, which is a little bit different for me. So yeah, I think that's kind of what my week or day looks like. A lot of studying, kind of organizing. I really enjoy kind of like my Sundays. I kind of sit and I organize what my week will look like. So that's the day that I kind of organize myself for the week. And I will say that my planner is my Bible. So I do sit and kind of write out my assignments for the week, my classes for the weeks, what's due, what readings are required. There is a lot of readings first year. Don't know if it gets easier second year, but we spent a lot of time reading some evidence-based, like some articles, and it's kind of getting the knowledge that we need. And yeah, that's kind of what it's like.
Danielle, thank you so much. It's a lot, right? You're both carrying
Yeah.
so much, and there's some acknowledgement in the chat to Danielle about the role shift that you're experiencing. Yeah, thank you both for sharing what your midwifery student lives are like right now. So given all the things that you're carrying, Yahida, for the last question, I think for this section of the session, what advice do you have for students to support time management, and especially if parenting while in grad school?
Yeah. So I have three kids. I have an older daughter who's 19, who's in college herself. And then I have a 10-year-old, and then I have a 9-year-old. And my two little kids are in competitive gymnastics and quite a lot of hours per week. And we travel to different states for different meets, and they're on different season schedules. So basically, we're in season at all times, it seems. So there's a lot to kind of juggle between the kids and then school. So I think something Danielle mentioned that has helped me is a calendar. So a lot of people like to do it electronically, but for me, again, I like the paper, I like the books. I have a calendar. I don't have it with me. But I have a calendar where I write down like all the due dates and assignments that are coming up so that I know what my time, where I'm going to have more critical times and where I'm going to have a little bit of more, time available. So I really, really, really feel like for me to be successful and not create stress for myself or for my family, I need to be organized and prepared. So organization for me is the most important. The second thing is communication. So I try to keep communication open with my kids. My daughter who's in college, I call her, like I said it as my time to call her when I'm commuting, that in those 90 miles, I make it a point to call her, or I call my husband at that time if I haven't been able to check in. So I think it also helps just to tell them, what you're going through, like what's due, what do you need done, or what's going on, or what happened in your day, or what didn't go so well, or what do we need to plan for, and things. So communication has helped a lot for everybody to kind of know where everybody's at and coordinate and plan. And then I think the other thing is like being patient and kind to yourself, because I feel like sometimes, you want to do the best that you can with everything, but, sometimes this isn't going to be your best work here, or you may miss an event here, or, you might be late to this or whatever. But I feel like sometimes we're so hard on ourselves to make sure that we're there for everybody. And sometimes you forget that you need a little bit of a moment for yourself. So I feel like I've been more aware of that as I've gone through the program. So being kind to yourself, and then, asking for help. I think asking family members, if you have family members that are nearby that are able to, for example, prepare a meal for your kids or for yourself. I feel like I always put my kids first. So it's like, I'll figure out what to eat, but my kids, especially because they're so active, need a lot of protein, for example. So I have to ask my mother-in-law sometimes for help to cook some meals, or, maybe have them on the weekend when they can take them to some event where I'm, going to be at the clinic or whatever. So it's kind of like a family affair, it's we're all kind of here helping support, and that's how we can kind of make it successful, by being able to ask for help, which maybe previously I wasn't as willing, but as again, as the program's gone on and you realize the amount of time and all the things that you're juggling, it is perfectly okay to ask for help.
Yeah, want to underline that one. Thank you, Yahida. So much awesome advice. But Danielle and Yahida, thank you so much for sharing your experiences and your perspectives. This has been, amazing. I'm gonna ask Lottie if you wouldn't mind stopping the recording,